The state of California is dealing with an acute crisis of homelessness and mental health, and officials are planning a new approach to tackle both issues head-on.
Here in LA and throughout our city and state, we all know that we are facing a crisis. We all know that we cannot address the unhoused population if we don't address mental health and substance abuse at the same time.
Two major proposals signed by Governor Gavin Newsom in October seek to borrow $6.38 billion to provide additional housing as well as services for people who are chronically homeless and have severe mental illnesses and deal with substance abuse. The proposals, which will appear as a single item on the voter ballot next March, have received wide support from legislators.
Every dollar, every program, every roof, every bed, every newly trained caring provider means one more person off our streets, out of the hospital, out of jail, out of a lonely back bedroom, and with the chance for a better life.
If approved, the initiative could add more than 11,000 treatment beds, housing, and over 26,000 outpatient treatment slots for 100,000 people annually. Medical experts are pleased that the initiative would train more mental health workers.
We're hoping that with the legislation, one, it'll help us train more psychiatrists on the street, but also provide us an opportunity to train ourselves up so that we can help fill that gap. The second thing, of course, is it's one thing to help them survive on the street, but it's another thing to get them in housing. And as long as they're just caught up of the chaos of the street, it's hard for them to really get control of their mental health issues.
Governor Newsom also signed a new law in October that would make it easier for state authorities to compel patients with mental illness or drug and alcohol addictions to receive care, in some cases against their will.
So, the question of whether you want to authorize more hospitalization and so on, I'm not really too keen on that kind of thing, but as I said, there are alternatives like outpatient commitment and assisted outpatient therapy that can accomplish the same thing with less intrusion, on liberties.
It's the biggest push by California to address a decades-long crisis that is seemingly spiraling out of control. And it's now up to voters to decide next year if they want to approve the heavy price tag to transform their state services for homelessness and mental health. Ediz Tiyansan, CGTN, Los Angeles.